Welcome to Healing Talks with Kingdom Docs.
Hi, I'm Dr. Hussein Musa.
I'm Dr. Adetoun Musa.
I'm a board-certified anesthesiologist, pain doctor, and addictionologist.
I'm a board-certified epilepsy specialist and neurologist.
And these talks are entitled More Than Medicine.
More Than Medicine. So why are we titling it More Than Medicine?
Because we believe that healing involves more than our traditional medicine.
Yeah.
Yes, we practice evidence-based medicine. We believe in the science, we believe in the medications, the hard work, the labor that went into developing certain treatment plans. They have their place. But what happens when patients don't follow the textbook?
Yeah.
What happens when their illness don't respond to all the medicine or all the evidence that we have at our disposal?
I'm reminded of a lot of different experiences with patients who don't read the textbook. As an epilepsy specialist, I have dealt with a lot of patients who have seizures that do not respond to medications. We've tried every medication available. We have referred them to surgery or brain surgery to help with the seizures. Nothing is working. Maybe the patient is suffering from the ramifications of uncontrolled seizures like injuries. They may even suffer from headaches. What to do next, right? What to do next? And one thing that I have really relied on is prayer, and also speaking life into that patient's just worldview and perspective on their illness so that they can actually believe that they're going to get better.
Yes, we know that our mindsets play a huge role in our healing. And prayer and faith, they're just not whimsical things. It's not wishful thinking. It's actually effective. The prayers of the righteous availeth much. And having prayer involved in your healthcare, having a believing physician, having a patient who believes that they can be healed, it will only benefit you.
Absolutely. Other scenarios that this is so important in, I'm remembering patients who might come in with headache, right? And a lot of people who suffer from headache have completely normal tests, completely normal brain scans. But then there's this tiny minority of patients where we find something wrong. And whenever you get a bad report, it can elicit all sorts of emotions like fear and worry and anxiety. But God, He calls us not to fear, that we do not have a spirit of fear, but of power, love, and of sound mind. And in those scenarios, it's really important to rely on faith as well. And as a doctor, if I'm using evidence-based medicine and science to come up with a treatment plan, I have found that if I have faith that God's going to work through that treatment plan, He's going to work through medications, that I share that faith with that patient. I say, hey, this is going to work. I believe this is going to work for you and you're going to get better. I see a lot of improvement. I even see improvement in death sentences like cancer, for instance.
Yes, hope is critical. And I like in our medical education, we start off with this mindset that I'm going to memorize every textbook, I'm going to memorize every medication, and somewhere along the line, toward the end of your training or even practice, you come to a point where you realize, I've learned so much, but this isn't helping me with this patient.
Yeah. So
what do I do next? And that's over time, physicians develop a gestalt, just kind of a understanding of what's wrong with this patient, or some may even call it intuition. And you'll always see the medical students or the junior physicians wondering, how did you know this was wrong with this patient?
Yeah.
Like what symptoms was it? What gave it away? But oftentimes it's the combined effort of your years of experience, your knowledge, and just your faith in this doesn't look right, and you stick with it and you keep digging deeper, and you can find out an answer that's never in the textbook, and it never will be in the textbook. And it comes from your clinical expertise. And when you combine that clinical expertise with faith and caring and love and prayer, your results are going to only improve.
And all glory to God in all of these improvements. In the next episode, we'll discuss faith and action and how that relates to getting better as a patient.
Please visit us at kingdomdocs.com.
Bye-bye.
Bye.